Good morning. Thank you so much, Janet, and thank you to the Diaper Bank of Connecticut, HRA of New Britain, and the Connecticut Hospital Association. I'm just so pleased to be part of this partnership. When a family lacks access to diapers, it impacts their health and their well-being. And a shocking statistic to me is that children under the age of 1 account for 40% of UTI hospitalizations here in the state of Connecticut. So we know that diapers are an essential means to ensure diaper hygiene, and they prevent a range of avoidable medical conditions in infants and young children. And here in Connecticut, we have an opportunity to expand access and to improve health conditions for a mom and her child. So tomorrow in the Human Services Committee, we intend to raise a concept that would extend Medicaid coverage of diapers to children from birth to age 3 with certain health conditions. This is a targeted policy intervention that will make diapers readily available to families with children who have a medical necessity and who experience other barriers to accessing this essential resource. It's also a very important and effective preventative health and early intervention strategy that'll benefit both children and, as you heard from Janet, and their caregivers. So we're hearing a lot this session about the state budget. And do we have money? Do we not have money? But this proposal, not only will it improve health outcomes for children and their caregivers, it's also good fiscal policy. In 2018, the Diaper Bank of Connecticut and the University of Connecticut did an economic modeling study. And in that study, they found that the incidence of diaper rash declined by 33% when families received a supply of clean diapers, and that babies experienced 77% fewer days of diaper rash. So given that this proposed coverage of Medicaid for medically necessity for children is targeted to those for whom, like I said, coverage is medically necessary, it's likely that the savings associated with the reduced avoidable use of healthcare services will offset the cost of the coverage. This isn't a time in our state for us to sit back. We need to be innovative. And having Medicaid cover diapers for medically necessary conditions for infants through age 3 is that innovation we need. Our proposal aligns with the Department of Social Services goals to improve maternal health outcomes and related maternal morbidity and mortality, and to address associated health disparities. And we are not the first state to be looking at this. Vermont, Delaware, Tennessee, and Minnesota have all gone in the direction of using Medicaid to cover diapers. So I am excited to see how many more families we can cover and support here in the state of Connecticut by expanding Medicaid coverage for diapers.